We are naturally focused on the momentous news of the first cases. But it's important to remember three key things. We were expecting this. These two cases do not change the risk of acquiring COVID in Yukon. And the incremental measures we are putting in place as of this evening are not based on these two cases. They are measures we were already preparing to announce for tomorrow based on the increasing circulation of COVID in this country and the risk that this poses to community circulation of COVID in Yukon. These cases are a couple from Whitehorse who traveled in the United States. They attended a convention, were notified of a case of COVID at the convention. According to advice they received, they carefully self-isolated at home. Due to symptom development, they were both tested. Test results were received within 3 days. They are continuing self-isolation at home. Contact tracing through public health is going on as we speak, and they're both doing well. They're meticulously following public health advice, and they were from the beginning. They were asymptomatic during travel. They phoned and they got treated as soon as symptoms developed, and they have mild disease. This is exactly what we were predicting as a likely first case in Yukon, and due to the containment and isolation, these cases do not change the risk to us, the public in Yukon. This case therefore illustrates the benefits of careful public health practice, good communication of risk, compliance with advice and direction from public health officials, and prompt detection of disease. Now, some of the measures. The first is about non-essential travel outside of the territory and also travel within Yukon. I am now strongly advising the suspension of all non-essential travel into and out of Yukon. In addition, I'm asking Yukoners planning to return home in the next 30 days to return as soon as possible. And in view of our need to protect remote areas, more remote communities with limited healthcare resources, I am strongly advising the suspension of any non-essential travel to Yukon's rural communities. Self-isolation for travelers, all Yukoners, not just international, but all Yukoners returning home and all visitors to the territory from outside Yukon are now required to self-isolate for 14 days. This includes anyone returning home from other provinces and territories by road or by air, as well as Yukoners returning home by road from Alaska. And we are putting mechanisms in place to monitor and ensure travelers are self-isolating. If you cannot self-isolate at home, there is an email, as included on the release, for information and advice. All Yukoners who return home and have respiratory symptoms, that means cough or fever or difficulty breathing, are asked to call 811 to get advice on COVID testing. Restaurants and bars. Restaurants must immediately reduce their seating capacity to 50% and have the means to space people 2 meters apart, and prepare over the next few days to offer takeout and delivery service only as of opening on March 26th. As of closing time tonight, March 22nd, Sunday night, all bars must close until further notice. All personal establishments must close by the end of the day, Wednesday, March 25th. This includes hair salons, barbershops, tattoo parlors, nail salons, and massage therapists. For gatherings of more than 10 people are now banned. These are social gatherings, and smaller gatherings should ensure spacing of 2 meters between people. And you should not attend any social gatherings, even less than 10 people, if you have any respiratory symptoms. Again, cough, fever, difficulty breathing. If you're over 65 or you have an underlying health condition, or if you have or if you work in healthcare, a healthcare facility, or in other essential services.